Hello everyone. Today we'll talk about how to treat sore nipples. If you've ever had sore nipples, or even worse, cracked nipples, you'll know what a nightmare it is. And it really doesn't help when everyone says to you, breastfeeding is not supposed to hurt. You must be doing something wrong. Or even worse, just hang on for 2 or 6 to 10 weeks until your nipples toughen up. The most important thing is to figure out why your nipples are hurting in the first place. The thing is, if you don't find and fix the root cause, your nipples just won't get better, no matter what else you do. The good news is, if you do fix the cause, things get better very quickly. Even when you have figured out what caused your sore nipples and fixed the problem, the skin and tissue of the nipple still need to recover and heal. The deeper the injury was, the longer this will take. A surface abrasion will be fine within a day or two, whilst a bad crack might take a week or more to fully heal. Either way, here are some things that will help speed up the healing process regardless of how serious it is. Nipple cream. Nipple creams help to soften and moisturize the skin of the nipple basically. Cream does for your nipple what lip balm does for your lips. In most cases, nipple cream doesn't make the skin heal more quickly, but it does help ease the pain and discomfort. But my favorite nipple cream actually comes out of my kitchen: coconut oil. It's wonderful for moisturizing the skin, and unlike other nipple creams, it also has antifungal properties. Please take note that if you have any sort of infection in the nipple, e.g. thrush or an open wound, a regular nipple cream may not be appropriate. You'll need a medicated ointment, and it's not a good idea to use creams intended for other parts of the body. So, no petroleum jellies, aqueous creams, or other lotions. Nipple creams are specifically formulated to not be dangerous for baby to ingest. Breast milk itself is actually one of the best lotions for healing cracked nipples. The anti-infective factors in the breast milk help to eliminate any germs that may be present, while growth factors and vitamins help the skin to heal. After each feed, express a few drops of milk and rub it into the nipple area. Make sure your hands are clean so that you don't introduce an infection to the nipple. Leave it to air dry before putting your bra back. Hydrogels are little gel pads that are designed to be worn in the bra against the nipples. They are intended to soothe the skin and help it heal. There is some disagreement on how effective hydrogels are, but some women do find that they help. Unfortunately, they can only be used for a short time, usually a few days, and they are quite expensive, so they are not my first choice. Do not use hydrogels if you suspect you have thrush or another infection. Wound care nurses will tell you that sunshine is an excellent healer for any kind of wound, and sore nipples are no exception. Sit with your nipples exposed to direct sunlight or through a window for a few minutes several times a day. Keeping the nipples clean is important to prevent infections. If there is any broken skin, it is advisable to wash the nipple with clean water after every feed so that you remove any bacteria that may have been transferred to the nipple from baby's mouth. It is also important to keep the nipple dry. Skin that is constantly wet becomes very fragile and can break very easily. This means you need to let your nipple air dry before putting your bra back, or go braless if you prefer. If you leak milk, it is important to wear absorbent breast pads and to change them as soon as they feel wet against your skin. If you have any broken skin on the nipple, there is a risk for infection. It's very important to prevent such an infection because an infected wound will take much longer to heal. The first step, as I said in the previous point, is to wash the nipple after every feed. Then you should also apply an antibacterial ointment to prevent infection. Breast shells are plastic domes that are placed inside the bra. They prevent the bra from touching your nipples. They won't necessarily make the skin heal any faster, but if your nipples are very sensitive, they may help keep you more comfortable in between feeds. If you do use breast shells, wash them well every day to prevent them from becoming a breeding ground for bacteria. You should never sleep with breast shells in place. They can easily move around and cause problems such as blocked ducts. They are Nipple shields are the last resort when all else has failed. I will honestly only recommend a nipple shield when it's either that or stop breastfeeding. Why? Because nipple shields come with their own problems. If not used correctly, they can cause breast milk production to decrease because the nipple is not stimulated enough. Baby can also become so used to the shield that baby refuses to breastfeed without it, having to carry around that plastic the whole time is just irritating. If you do decide to use a nipple shield, please do so under the supervision of a lactation consultant that can make sure it is not affecting your milk production or baby's feeding, and ensure that you still address the problem that caused the sore nipples in the first place. In some cases, the nipple is so painful that you just can't bear to feed baby on it. If that's the case, you can express the breast and feed the milk to baby with a cup. If the nipple is already damaged, I would definitely recommend hand expression rather than pumping. There's a good chance the pump will damage the nipple even further. There's a few reasons why it's important to keep expressing every 3 hours while the nipple rests. Firstly, you need something to feed your baby, and expressed breast milk is definitely to be preferred over formula. Even if there's a little bit of blood from the nipple in the milk, it's not harmful except if you're HIV positive. Secondly, you need to keep stimulating milk production. If you don't remove the milk from the breast, your body will assume it needs to make less milk. And thirdly, you don't want the breast to become engorged or develop mastitis, both of which can happen if the breast isn't emptied frequently. Once the nipple feels a bit better, you can try to get baby back on the breast. Take great care to latch baby well so that you don't repeat the same process and end up in the same situation again. All the treatments I've described have one thing in common: they don't fix the problem. They are at best a band aid, and they help you feel better and they help the nipple heal. But if you don't find any and address the initial cause of the nipple pain, the problem will keep repeating itself. So please figure out what caused the pain in the first place, get help if you need to, so that you can be breastfeeding pain free as soon as possible. Thank you for watching.